So again, the face. Now I will talk about the muscles of the facial expression. To understand and remember the names and actions of the muscles of facial expression, the best method to classify the muscles is according to the openings which are regulated by these muscles, and these muscles are surrounding these openings. First of all, we will see the opening of the eyes. Very beautiful organs are situated in the orbit and are opened on the face by a fissure known as palpebral fissure. The palpebral fissure these are the palpebral fissures. Palpebral fissure. The opening of the nose, the nostrils, and the oral fissure. So understand, to understood the muscles in best way. Muscles surrounding the palpebral fissure, and some muscles are also seen in front of the auricle, above the auricle and behind the auricle, which are almost vestigial in human beings. So in these all openings, especially the opening of the eyes and mouth, one muscle is sphincter and it is closing the opening, and all other muscles which are surrounding and radiating from the opening are the dilator. So one muscle is sphincteric and it is closing the sphincter and it is having sphincteric action, and it is concentric the opening. Other all muscles which are surrounding the openings are radiating from the opening and are dilators from the opening. The muscle which is sphincter from the palpebral fissure is the Orbicularis Oculi. I will draw the muscle here. This is the root of the nose. So Orbicularis Oculi. Orbicularis Oculi. Orbicularis is the word used for concentric, so it is encircling the eye, so known as orbicularis, and word oculi is used for the eye. So Orbicularis Oculi is having three parts. It is encircling the opening of the eye or palpebral fissure. The inner part of Orbicularis Oculi is taking origin from the medial palpebral ligament, running laterally, elliptically, to be inserted on this lateral palpebral raphe, running anterior to the tarsus plate of the eyelids. So this part of Orbicularis Oculi is known as palpebral part of Orbicularis Oculi. This part closes the eyes gently like this, like in wink, blink and squint, especially during blinking and sleep. This muscle closes the eye. So this is the palpebral part. The outer part of Orbicularis Oculi is formed by the orbital part. Fibers are taking origin from the medial palpebral ligament, part of the frontal bone and part of the maxilla, and fibers are returning back to the point of its origin. So these are encircling the palpebral fissure, taking origin from the medial palpebral ligament, part of the frontal bone, part of the maxilla. Outer fiber, that is the orbital part, is forming a concentric layer around the palpebral fissure. While the palpebral part is seen only in upper and lower eyelid, taking origin from this medial palpebral ligament, running outwards elliptically and inserted on the lateral palpebral raphe. This is the medial palpebral ligament and this is the lateral palpebral raphe. A small part of the muscle is seen in lacrimal region, taking origin from the posterior lacrimal crest of the lacrimal bone and the lacrimal fascia. Fibers running laterally and inserted on the lateral palpebral raphe, and this is the lacrimal part. So when this lacrimal part contracts, it will give attraction to the lacrimal fascia and it will move the lacrimal papilla, which will help in draining the lacrimal fluid in the lacrimal sac. So it will unmask the lacrimal sac for drainage of the lacrimal fluid. This is the lacrimal part. When the palpebral part contracts, it will blink or close the eyes very gently like in sleep, this action. Or this action, this is the action of the palpebral part. But when the orbital part contracts, it will closes the eyes very forcefully like this. This is the action of the orbital part. When all three parts contract simultaneously, these will produce the wrinkling of the forehead, the temple and the cheeks, like this. These wrinkles, which are produced in the lateral angle of the eye, are seen permanently in some old aged persons and known as crow's feet. Can produce crow's feet. Crow's feet, not feet. So this is the Orbicularis Oculi. This is the palpebral part, and this is the orbital part and the lacrimal part of the Orbicularis Oculi and sphincter muscle. So primarily this is the sphincter for the palpebral fissure. The facial expressions are the side effects of these muscles action. So I will talk later about the action of these muscles. Primarily we will see only the primary action of the muscle. The other muscle of the palpebral fissure is the corrugator supercilii. The corrugator supercilii, which is lying deeper to the Orbicularis Oculi, lying deeper, taking origin from the medial part of the superciliary arch. So deeper to Orbicularis Oculi, running upward and laterally to be inserted on the dermis of the middle 1/3 of the eyebrow and upper part of the eyebrow. So fibers are running from here up to here, but these are deeper to fibers of the Orbicularis Oculi. So this is the corrugator supercilii. The corrugator supercilii. It produces the vertical wrinkles, especially in frowning. Corrugator supercilii, when it contracts, it draws the skin of the forehead towards the medial angle of the eye and produces the vertical wrinkles in frowning. Some deeper fibers of the Orbicularis Oculi, which are attached to the dermis or subcutaneous tissue, are known as depressor supercilii. So this is depressor supercilii and this is the corrugator supercilii muscle. So this is the corrugator. The meaning of corrugator is wrinkles. So remember the corrugator. By wrinkles. One muscle, which is the muscle of the cranium, the cap of cranium, the scalp, the epicranius, which is having two bellies, frontalis anteriorly and occipitalis posteriorly. So frontal belly of the occipitofrontalis or the frontalis is also forming the muscle of the palpebral fissure. So it is coming from this part. It is also superficial to the corrugator supercilii. The frontalis. approximate to each other in medialmost part. So this is the frontalis. When contracts from above, it will pull the scalp forward, but it contracts, when it contracts from below, it will produce the transverse ridges on the forehead like this, and it is antagonistic muscle to the orbital part of the Orbicularis Oculi. So antagonist to the orbital part of Orbicularis Oculi. So this is the frontalis. The muscle which is seen in this region is not a muscle of the facial expression. This is temporalis, not a muscle of facial expression. This is the muscle of mastication. This is the muscle of mastication, the temporalis. So frontalis, corrugator supercilii, orbital part, palpebral part, and the lacrimal part of the Orbicularis Oculi. One more muscle which is the muscle of the orbit, the levator, palpebrae, superioris, extraocular muscle, levator, palpebrae, superioris, which is a muscle of the extraocular region, and it is not innervated by the facial nerve. That is the levator, because it elevates. Levator, palpebrae, superioris. So this levator, palpebrae, superioris, when it contracts, it elevates the upper eyelid, and it is antagonist to the palpebral part of Orbicularis Oculi. So these muscles, the frontalis, Orbicularis Oculi, corrugator supercilii, depressor supercilii, and the levator, palpebrae, superioris, are forming the muscles of the palpebral fissure. One is sphincter, that is Orbicularis Oculi. All others are dilators. One more muscle which is taking origin from the sides of the nose, especially the root and upper part of the nose. Fibers of these muscles continue with the medial fibers of the frontalis. Fibers of this muscle are continue with the fibers of the medial fibers of the frontalis. This is not a muscle of the palpebral fissure. This is a muscle of the nose, and this is the procerus. And it acts with the corrugator supercilii in the act of the frowning. Corrugator supercilii is producing these vertical ridges, while the procerus is producing these transverse ridges on the root of the nose in frowning. So this is the procerus. Now we will move on the muscles of the nose. This is the outline of the nose. So one muscle of the nose is procerus. The second is nasalis. And it is having two parts, the transverse and the alar. The transverse part fibers are taking origin from the maxilla, running medially and can also cross to the opposite side and inserted on the fascia on the dorsum of the nose. So these are transverse fibers named as compressor nares. So these are fibers of compressor nares. These are fibers of the nasalis taking origin from the maxilla, running medially upward to be inserted on the dorsum of the nose at the junction of the cartilaginous part and the bony part. So these fibers, when contract, compress the nostrils, so named as compressor nares. So this is the first part of the nasalis. The other fibers which are after taking origin running on the alar part of the nose, on the alar part of the nose, and this is the alar part of the nasalis. The alar part is named as Levator nares. Levator these fibers will open the nostrils with the depressor septae, as we can see in anger. And fibers of the other muscle of the nose are taking origin from this maxilla, running upward to be inserted on the nasal septum. These are fibers of the depressor septae. When these fibers contract, these fibers will also lead to opening of the nostrils with the alar part or dilator nares part of the nasalis. So this is also seen in the anger. One more muscle in the area of the nose is the Levator labii superioris elecunegi. Fibers are taking origin from the maxilla, medial fibers running upward and medially to be inserted on the nose, and lateral fibers are running downwards and laterally to be inserted on the upper lip. So this is Levator labii superioris elecunegi, having very impressive name. So these are the muscles of the palpebral fissure and the nasal or nose. Now after a short break, we will see the complicated fissure, which is surrounded by many muscles and also having sphincteric and dilator action, the oral fissure after a short break.